Welcome back. We're joined by Colin Craig. He's president of secondstreet.org, and we're talking about healthcare and Canada's healthcare. Does it need to be reformed? And if so, how and when and why? Well, Colin, again, I appreciate you coming on. One thing we need to start with is a basis of facts, which is where does Canada actually rank globally in the world? You mentioned there's some countries that have a universal system, they do it better. Are they on par with Canada economically? Are we even spending enough? Maybe that's part of the issue. So share with us some of your research insights.
Yeah, so I mean, the simple answer is that we are among the highest spenders in the world when it comes to healthcare. And that's not my calculation. Governments across the country, doesn't matter if they're NDP, Liberal, Conservatives, they all fund an entity called the Canadian Institute for Health Information. And that body collects all kinds of healthcare data from across Canada and they publish it. And when you look at their website where it talks about funding, it notes very clearly on it, Canada is among the highest spenders on healthcare in the world. So we know there's a lot of money in the system. I mean, a little bit more good news is that it's not that governments have to go out and spend a ton more. There's already a lot of money in the system. We need to figure out how exactly we can get better results for those dollars that are being spent. The problem is that too often those dollars are not helping patients. So one of the crazier examples that we often talk about is how in Windsor, Ontario, the hospital is running its own Tim Hortons. It's not a private Tim Hortons in the hospital. It's the hospital using hospital staff running a Tim Hortons, and they've lost $2 million over the last decade or so. They cannot figure out how to run a Tim Hortons and break even. Tim Hortons is one of the most successful franchises in Canada. So they've been losing money running a Tim Hortons. And what does that mean? That means that money that was given to that hospital to help patients, to provide surgery, to help people in an emergency room, whatever, those dollars have been used to finance this Tim Hortons that's losing money. So there's
Wow.
all kinds of examples like that in the healthcare system where the dollars aren't reaching the front lines to get to support the front lines to provide the care that patients care about.
Okay, can I
We
ask the
have $2
question
billion
then?
wasted on bureaucracy in that too. So, if we would do a better job spending the money that's in the system, then we could get better results. And that's really what we look at in the documentary, is to look at what other nations are doing better to get better bang for their buck.
But Colin, I mean, you brought up a very glaring example of mismanagement. Like, I don't think people want their healthcare tax dollars going to subsidize a Tim Hortons franchise, which sounds like that's what's happening. If that is being mismanaged, should I even ask the question? Then how can I trust these bureaucrats or these administrators in the hospital to manage healthcare dollars if they're not even making it to the patients, these dollars? I mean, this is a concern. This is a great concern. Okay, so we'll just leave it at that. Knowing
Mhm.
that we do fund healthcare quite robustly vis-a-vis other nations in the world, so this is not a spending issue, it's a management issue. How and what could our healthcare system be doing to manage things better?
So I think one of the most important changes that we need to make in the healthcare system is, instead of governments cutting big checks to hospitals each year and saying, good luck, we hope you can help a lot of patients, they need to do what a lot of European countries do. And that is to instead fund those hospitals every time they help someone. So in other words, you get something done, you get money. I mean, that's the way the rest of the world works, right? You walk into a store, you buy something, then that store gets money. I mean, they have the incentive to sell things and get things done and help people. And so if we change the healthcare system so that it's more focused around getting results and helping patients, then you start to see the hospital operations change. They become very cost effective and efficient and focused on helping patients instead of these distractions like running Tim Hortons franchises. One surgeon we talked to in British Columbia scoffed about how if we made this change, well, then the hospital would spend less money on changing the computer system again. He emphasized that point as someone working in the system who's frustrated seeing these dollars spent in the healthcare system in ways that aren't helping patients. So if we restructure the system to focus more around helping patients, we would see greater output. They would become more cost effective at delivering care. And one bit of good news is we've seen Quebec doing this. They've been really aggressively doing this more and more for about the past 8 years or so, and they've had some very positive results. So we're seeing some positive changes happening in Quebec. Some other provinces have experimented with this a little bit. I think we need to see more of a wholesale shift towards this policy, which has been so effective in other parts of the world.
And I think that's why I recommend people do view your documentary, because most of us probably just assumed that hospitals were getting paid per surgery or per patient, not in a bulk check. We'll pick this up in just a moment.